Good afternoon and welcome to today's Inclusion Works Community Advisory Committee meeting. Before we get started, here are a few reminders about the webinar. Please make sure you're using a computer or smartphone connected to the internet and the audio function is on and the volume is turned up. Please be sure your microphone is muted for the duration of the call unless you're speaking or asking questions. To ask questions, use the Q&A feature located on your control panel, and we will answer as many questions as time allows. American Sign Language interpreters and closed captioning options are available for today's event. The American Sign Language interpreters for today are Danette Stillman Bridges and Callie Marsh. For closed captioning options, select the closed captioning feature located on your control panel. To adjust your video layout and screen view, select the View feature located in the top right-hand corner of your screen and choose the view that works best for you. Today's agenda topics include advisory details, an overview of Inclusion Work Strategic Plan, and a discussion on employment assessments and CIE liaisons. This will be followed by provider innovation grants and training and Inclusion Works data summary. There will also be time for questions after the presentation. At this time, I would like to turn it over to Claire Colligan, IDD Employment Lead for IDD, TBI, and Olmsted section of the Division of Mental Health, Developmental Disabilities, and Substance Use Services.
Thank you, Latoya. Good morning, everybody, and Happy New Year. It's great to see so many people coming back. We're really excited about all the things we're going to be working on this year. Latoya just went over our agenda for today, which is similar to the updates we give you all the time, but we are also looking forward to some of the newer initiatives that we're planning, a lot of which are based on feedback that you have given us. And that is greatly appreciated. The participation from the community has been incredibly helpful, both with the development of the strategic plan, as well as implementation of the strategic plan. And those of you who are helping us with working on those small breakout groups, we're going to talk a lot about that today as well. So could I have the next slide, please? Okay, so besides myself today, you have Adrienne Kittle, who is the program specialist for IDD at EIPD. And she's going to talk a lot about the collaboration work that is happening in that space and the incredible amount of progress that's been happening. Catherine Titus is here from WISE. Catherine is going to be talking about very exciting updates that we have to our WISE Online Academy for the ACRE certification, as well as the Provider Innovation Program, which is now, I want to say, entering its 6th month for those who are currently enrolled, and we're going to be having new applications coming soon. Maya Glass is here. She is the Data Quality Specialist for DMH DDSUS. And Yolanda Perkins, we could not do anything without Yolanda Perkins and the team at Work Together NC. Yolanda is the implementation specialist for Work Together and an incredibly important part of our collaboration with this work. Next slide. Okay, so just a little bit of a reminder about what this meeting is. And if you can go to the next slide, that would be super helpful. Making sure that we get input and feedback from the entire community, particularly those people with lived experience, people who are working in the community, their family members, their caregivers, their assistants, all of the people who are involved, including providers, advocates, and agencies that are assisting people to move the state forward in terms of making sure people have access to employment, and particularly CIE, but all kinds of employment. So DHHS wants to at least do this meeting quarterly to make sure that we can share all of the updates and get your feedback on the implementation of program activities. I want to also say that please don't feel that you have to wait until a meeting like this. My email is going to be on these slides and is available to all of you. You can always feel free to reach out to myself or other people on this leadership team so that we can be ongoing providing input, accepting your input, and providing changes to our strategic plan as we go forward, to make sure we keep this as collaborative as possible. Next slide. Just also a reminder, the community meeting is meeting quarterly. These are the dates of the meeting for this year, for 2026. Can't believe it's 2026. We are still thinking about an after work hours meeting. Gotten some both positive and negative feedback on that. So we're still trying to figure out the best way to reach as many people as possible. If you have ideas and thoughts, please let me know. There is a link, which we will make sure that everyone has, to sign up for all of these meetings. That they are, this meeting is provided by the state of North Carolina. And so we want to make sure you have a link to sign up to all of these meetings every month. Next slide. Okay, so what's happening with Inclusion Works? The last time this team met was in October. And if we can go to the next slide, I can tell you what else is happening. And so we're going to talk today about the latest WISE provider transformation and provider innovation progress, and that we are opening our applications for the next cohort of this. This so far has been incredibly successful. We will continually provide information to the public about how the providers that are currently, there are 4 providers currently in this process, and how things are going for that. With Work Together NC and the design team at UNC, we are currently working on a new video. Many of you have seen our What is CIE video, and that video is available on the website. And we are working on a new one that talks about informed choice and uses input from people who are currently working out in the community on how they make informed choice. March is Developmental Disability Awareness Month, and so DMHDD SUS has a lot of activities planned. The IDD section has been working really hard on this. We're going to have a lot of things happening that month, so stay tuned. We would love input and we would love participation. March is a great month for us. We want to really celebrate developmental disabilities and awareness. And we are still working on revising our webpage and trying to be as innovative as possible and make sure that webpage is as informative as possible and is useful to those in the public who are trying to access information. Next slide. So we're going to talk a little bit about the strategic plan and the implementation that we have been doing since this plan was published in August. We have done a lot of work, and just as a reminder, our 5 specific goals, which are then broken down into objectives and strategies. Our 5 goals are informed choice, quality IDD services, community outreach, workforce development, and employer connection. We're going to talk a little bit more in depth about those. I'm going to hand it over to Catherine Mollenkoff, who is our, I can't remember your title, Catherine, I'm sorry, but she's just the most important person. So Catherine, I'm handing it off to you. Thanks for the help.
Thank you so much, Claire. Hi, everyone. My name is Catherine, and I provide project management support for the great work at Inclusion Works. So next slide, please. This morning, we just wanted to provide an update on the completed, ongoing, and future work related to Goal 1. So as Claire was mentioning, Goal 1 from the strategic plan centers on informed choice, which is so central to all the work that we do as a team across activities and partnerships and focus areas. So Goal 1 states that provide people with IDD the opportunity to pursue competitive integrated employment if that is their choice. So as Claire was also mentioning in our work plan, each goal is further broken down into objectives and strategies. You will see a few of the objectives and strategies for Goal 1 on this slide right here. And also in our work plan, we further break this down into tasks that are assigned owners. So there's accountability, and we are able to track progress across all the different amazing work that this team does. So as I said, Goal 1 is further broken down into objectives and strategies. So you can see Objective 1 at the top there. And this states an informed choice process will be followed to empower people with IDD to make decisions based on a complete understanding of employment options. Below that, we have 4 strategies that map onto this objective. So I just wanted to provide a brief update on the work that has been going on with these strategies and their associated tasks. So starting with strategy 1.1, it is listed there, but it really is focused on developing a process for individuals to make an informed choice about their employment options. So I'm happy to say that this strategy we have marked as complete. We have defined a process flow and handoffs for employment assessments and career development plans. We have defined role responsibilities for care coordination staff. So this is with EIPD, RCIE liaisons, tailored care management. You will hear more about this later on in the presentation. We've also shared responsibilities and process flows with tailored plan staff, work together NC, and providers. Strategy 1.2 is listed there and focuses on completing employment assessments and co-creating career development plans. So this centers on our ongoing work with our wonderful partners at Work Together NC, who go out to provider sites and conduct employment assessments with individuals who have given their consent to do so. You will hear from this team shortly and get an update on the employment assessment process and all the work that has been going on there. For strategy 1.3, this focuses on additional skills assessments and observation opportunities for people with IDD. So this is another ongoing strategy that is with EIPD and fantastic work on that team as well. So some of the tasks related to this center on offering paid internship opportunities, completing vocational evaluations, community-based assessment, and supplemental evaluations to determine job interests and employment pathways, and providing pre-ETS activities to students for job exploration and work-based learning. So great ongoing work with EIPD there that we track in our work plan. And our last one, 1.4 for this one, is about revisiting individuals and conducting reassessments, so employment assessments as needed to confirm informed choice regarding employment. So this is part of our future work. This has not yet started, but will begin once the first round of employment assessments are conducted at all identified provider sites. So exciting work to come here, and to talk more about employment assessments, I am going to hand it off to Yolanda Perkins from Work Together NC, who is going to give an update on the work there. Thank you all.
So, thank you, Catherine, and thank you all for joining us today. I'm excited to share an overview about the Inclusion Works employment assessment process, excuse me, which is what we consider a key component of North Carolina's effort to expand competitive integrative employment opportunities for individuals with intellectual and developmental disabilities. So as part of the Inclusion Works initiative, Work Together NC collaborated with DHHS to develop a standardized employment assessment that Inclusion Works is now using across the state. So this standardized approach helps to ensure that every individual, no matter where they receive services, has access to a consistent person-centered process that supports informed choice about employment options. So I'll give you a quick overview of what the process looks like. What happens is that our Work Together NC team travels on site to each participating provider location to conduct the assessments. And this allows us to meet with individuals where they are. We try to minimize disruptions to their day and want to ensure that they have a comfortable, familiar environment as they are working with us. Each assessment takes typically about 30 minutes to 1 hour to complete, depending on that individual's needs and responses to the questions. We begin the process with coordinating with the provider site ahead of time. So this includes confirming logistics such as space availability, the number of individuals participating, and any accommodations that may be needed. We also work directly with the provider staff to ensure they understand the process and can help facilitate a smooth experience. So one thing that's very critical to the process is a consent. We have 2 assessment tools, one that we have designed for individuals and one for family members or guardians. And provider agencies assist with sharing and collecting the signed consent forms with us, which authorize participation in the 2 assessments. So we do always make sure that we get the individual's perspective as well as any family or guardian members' perspectives as well. So during the assessment, our team uses employment interest assessment questions to explore the individual's strengths and interests and goals. And the purpose is not to evaluate their readiness for employment or competitive integrative employment, but more to support informed choice. which is about helping each person consider whether employment in the community is something that they want and what supports they may need to pursue their goals. Once we finish with the assessment, we always thank our providers for being such wonderful hosts. And all that information is then flows to CIE liaisons. We indicate to them which individuals and their guardians have indicated that they are interested in CIE or competitive integrative employment. And we also have the data for those that are not, along with their reasons why. We then continue to, with this process, to ensure that planning and services coordination is happening, because what we want to ensure is that a transition from assessment to action is taking place. So I just wanted to give a great thank you. As Catherine had mentioned, that we've been going out and doing the assessments, and Maya is going to give you some information about the number of assessments that have been completed since the end of last year. But right now we are spending some time with OE Enterprises. So OE Enterprises, thank you for all of your support with having us being able to come out to your site and complete the assessments. We've also had the opportunity to meet the staff and clients at Allegheny County Group Homes, and we appreciate Avery County Group Homes, as well as News Enterprises, with starting the process for getting the consents collected and scheduling the time. And we're waiting to hear from a few other providers. But as Claire mentioned, if you have any questions about the process, please feel free to reach out to us as we work with DHHS to ensure that informed choice is happening and that we are opening up opportunities for competitive integrative employment. Thank you. I will turn it over to Adrian to give you some more information about the CIE liaisons.
Thanks, Yolanda. In my role, I'm the program specialist for intellectual and developmental disabilities with EIPD. I work very closely with Donna Rice, our outreach program manager for the CIE initiative. So as part of the process, as Yolanda mentioned, the provider or facility is responsible for getting those consents that allow this close collaboration once we receive a referral from Work Together NC. So if you'll go to the next slide. So this team meets frequently to receive and review the referrals from Work Together NC. So as part of this process, I think what's helpful is that we have the tailored plan, the CIE liaison care coordinators as a part of this meeting, and they can share information that EIPD may not know otherwise in terms of the funding source that would be available to these referrals that's necessary for EIPD as we're coordinating those long-term supports. So having these initial conversations where we can identify who the tailored care manager is, if there is one, identifying what the funding source availability is, all of that information is helpful for the referral to EIPD. But in the beginning, those CIE liaisons reach out to the referrals, review the employment assessments, have some conversations just reinforcing their interest in pursuing competitive integrated employment. If there's concerns or questions, they're available to help connect with resources to answer those questions so they can make an informed decision in choosing to pursue services related to competitive integrated employment. So once those conversations have been had and the individual continues to express an interest in services related to CIE, that's where in those weekly meetings, we determine which CIE liaison is responsible for making that contact with the individual and then proceeding with the referral to EIPD. And so that CIE liaison counselor will be the one to reach out to that local EIPD office to explain the nature of this referral and to provide the information that they've gathered as a part of those initial meetings. So hopefully we've identified the funding source to help that EIPD counselor understand what's going to be needed for that long-term funding. We've evaluated the prior documentation and the records that counselor is going to need to assess eligibility for our services, and all that information is gathered. So then when they initiate the referral to EIPD, it's a little bit of a smoother process. And then also the individual who's being supported understands that process a little bit better, and the roles of the EIPD counselor. So if you'll go to the next slide. So again, this reviews the purpose of the team. So it was really designed to support individuals who've been in non-CIE settings, who have expressed an interest in services related to pursuing competitive integrated employment. And this slide speaks to the need sometimes for that additional support to make the connection to EIPD, and then also to stay engaged. It can be a complicating process in general, and so sometimes these individuals may need a little bit more support if they have additional questions or concerns. The CIE liaison team is there to support that individual. And then to continue to follow them even after the application is made, because really the hope is that these CIE liaisons will support both the individual and the EIPD counselor, so that they can support that individual in reaching in completing the application, assessing eligibility for services by providing the documentation that we often need to assess eligibility for services, but then also to stay engaged to develop that individualized plan for employment. So right now to date, we've had about 56 people who've been referred, who've gone through the work together in CE process, and consented to proceed with the referral to the CIE liaison. Of those, we think about 28 individuals have submitted the application to EIPD. And then I think, actually, I'm trying to do some update. I think we have about 8 applications that have been completed to date with the EIPD, and it may actually be a little bit higher than that. And then I do know that we've had at least 4 individuals from this pool that have reached the individualized plan for employment development and initiation, which means that supported employment services funded through EIPD are ready to be initiated or have been initiated. So next slide. So this slide speaks to the CIE liaison, the team success. Really, their focus is to help individuals follow these referrals through the initial steps with EIPD. So helping, like I said, to provide information regarding funding, if there's a tailored care manager involved, and then supporting the individual through our process. And once that plan for employment is developed, then that may be where this role can back off and be a support if the individual wants to reach out to them with questions. But at that point, once the plan for employment is developed, then the EIPD counselor takes over as the primary coordinator of services. But certainly that CIE liaison would be helpful if there's any questions about coordinating the service for funding when it falls back. Like EIPD funds the supported employment services to help someone get the job. And then we also fund the initial job coaching once a job is found. But at some point, our funding ends, and then we transition back to the tailored plan for funding of those long-term support. So the CIE liaison would be helpful if the EIPD counselor does have questions, or we need to, if there's been a change in tailored care manager and we're not sure who to reach out to, that would also be a role of the CIE liaison through the tailored plan. So I think I've spoke to most everything on this slide. So next slide. And then, so again, if you want more information regarding the employment assessments and general inclusion works, you can go to the website or scan the QR code to find some specific Q&As and other information regarding this process. And I think I'm going to turn it over to Catherine.
Hi, everyone. I'm Catherine Titus, and I work for WISE, and we get the opportunity to provide technical assistance and training here with the overall provider innovation work and trainings available. So on the next slide, we have a description of the Provider Innovation Program, which is a part of the work we're doing. And the real exciting thing to mention about this that Claire had mentioned at the beginning is that there will be an opportunity to apply to be a part of the Provider Innovation Program coming up here end of this month. You'll see that roll out from our partners at Inclusion Works. And the goal really is to look at how to make some change within your agencies and provider organizations to really enhance customized, individualized employment opportunities for North Carolinians across the state. So we're excited about that, and that process includes an organizational self-assessment, a strategic action plan, personalized training content, some ongoing technical assistance, and Inclusion Work supports all of that with financial incentives as well. So on the next slide, you'll get to opportunity to see where the first 4 providers, some of you are here. I saw your names. Welcome. I saw you pop in here as you entered. So glad to have you here. So Vocational Opportunities of Cherokee, Allegheny County Group Homes, Inc., OE Enterprises, Inc., and Noose Enterprises were the first 4 chosen. There were a number of providers who applied. And you all are just about finished with the development of the training and TA plan and the action plans. So this is an exciting time of like setting goals around CIE jobs for people with developmental and intellectual disabilities. And you all have also been a part of ongoing meetings. So really those 4 providers were able to they started last early summer and then really got rolling with our welcome and orientation this fall. So it's been awesome to meet with those 4. And on the next slide, it describes some of what's happening currently. So the 4 provider organizations we're having, and you could expect this if you are here representing a provider and you apply and are chosen, you could expect something similar to be happening for you. So we have monthly provider innovation cohort gatherings. So all of the providers, and those meetings are facilitated by Chris Brandt, who worked for a provider, was the director for a provider in Washington State, which is where I happen to live. And they made great change at their agency. So it's an opportunity for everyone to come together. We also we meet monthly individually, providers and WISE with technical assistance. Myself and Jamie Leighton and Robin Slocum are working on that part of the project. We've got customized training opportunities through a Train the Trainer WISE professional learning site in our learning center. And so the providers are currently working with Robin on that piece around training for all of the staff, different staff members, looking at what's available in our WISE Learning Center, which is over 300 training opportunities, and then what else might need to be developed. And then for those providers who are currently a part of Provider Innovation, we've got an opportunity to be a part of some additional training offerings that are live online opportunities, such as plan to placement and recruit, cultivate, retain. So just really trying to bolster the efforts that these 4 providers are already making towards employment outcomes, with the adding in some additional opportunities. So on the next slide, some things that are available to not just the providers who are a part of Provider Innovation, but to most of these are available to any of you in North Carolina who are doing this great work towards employment, enhanced employment for people with disabilities. We have our Online Academy 100 series, which is it's a 4-part self-paced training series, ACRE certification series with a customized employment emphasis. There's a practicum which has followed up that was open to the first folks who had completed the Online Academy 100, and we've got our first group of students who have this January will be our 6th meeting, which is a 6-month practicum. And all of those folks have been working on a website portfolio for job seekers, so we're excited about that. The Online Academy 200 series is really an advanced training program for seasoned professionals. And through partnership with Inclusion Works, we've had 8 spots open for that series, which began this month. And so that's a very hands-on, intensive 6-month training to really advance those skills. So we're happy to have that available to those folks. And then some of you here may have been a part of the North Carolina Self-Employment Community of Practice. So that is running January through June, and Friday was the first session, which was awesome. And there were, we'll look at the numbers, but I think we had about 35 people attend. And I would say, I know we've had the first one happen, but if you're here and you're just hearing about it, let me know and I can get you in. You can catch up on what you missed. So my last slide is really just showing some of the numbers. I know after this, Maya will talk about data, but I've got just a few numbers to highlight some of the things that have happened so far. So we've had 109 people from North Carolina who have signed up for the WISE Online Academy 100 series so far, and have either completed or in process of going through that work. We've had 8 students who have been a part of the practicum each month and working on those website portfolios. 7 out of the 8 spots for the 100, or excuse me, the WOA WISE Online Academy 200 series, which started this month, which is really cool. Glad that had worked out for people to be a part of. And then 32 folks who were at the first self-employment community of practice. So a lot happening, and we're really excited about that. And as the Provider Innovation folks are setting goals and already working really hard to make change in their communities and across the state. Part of the exciting piece to me about the cohort, the monthly cohort of the Provider Innovation providers and this work, is really bringing all of you together as providers and the support that you can provide each other. in feeling and understanding even more in depth that this is like work you're all doing together. And so it's a really cool project to be a part of, and I'm grateful for that. So now Maya Glass, the wonderful data-oriented Maya Glass, is going to share with you.
Thank you, Catherine. Hi, everyone. My name is Maya, and I am the data quality specialist here. We can go to the next slide, please. So just to kind of continue on the great work that everyone's been doing, I wanted to pull a specific data metric and kind of go a little more in depth on that. So this is going back to Yolanda's work at Work Together NC. For our employment assessment data. And this is as of November 2025. So we had 81 total employment assessments completed. And out of that, large majority, specifically 84% of the people were interested in pursuing CIE, which is really exciting. And I was looking at the data this morning for what we have in December, and it's really exciting that these numbers are continuing to grow. And it just, again, is a testament to all the really hard work that everyone's doing, Yolanda and her team. So this is really great numbers that we're seeing here. Next slide, please. Thank you. Another exciting development is that I am working on building a dashboard for Inclusion Works that is directly tied to our strategic plan. And so this will be public facing, basically just to highlight and track all of the progress that we've been making with the 5 goals that were outlined in the strategic plan. So each goal has some metrics. For example, the number of individuals who have completed the employment assessment, like I showed in the earlier slide. Also the number of people receiving supported employment services or stakeholder events, internships for people with IDD. So that will really be a place where everyone can come see all the data in one place and be able to track progress over time. So I'm really excited to be developing this. It's still in the works, but I would be on the lookout for news with that in the future. And I'm going to hand it over back to Claire. Thank you.
Thank you so much, Maya. Thank you, everyone, for these terrific updates. As you can all see, there is a lot of work happening in the Inclusion Works area. We need everyone to continue to participate and be a huge part of the changes here. For all the people with intellectual and developmental disabilities in North Carolina who choose CIE or who choose to work in other settings, their choice matters. We want to make sure we can help them in any way possible. We've got a lot of training opportunities happening. The State Employment Leadership Network, of which the state of North Carolina is a member of this, we have the ability to offer people, especially people who do care management services or other kind of supportive services for people getting jobs. There is an e-learning course, which is fantastic. It is self-paced. There are start and end times. We are opening a new section. They are opening a new section in February. And we want to make sure that people have the opportunity to take that. If you are interested in taking that course, we're really happy to get you enrolled in that. Please just email me. My email address is on a lot of these slides. So please reach out if you're interested in that e-learning course. We've had a number of people take the course over the last year or so, and I have only heard really positive feedback about that. One person who took the course actually said that they felt like everyone in their agency should take it, which is should tell you how valuable it was. North Carolina APSE has a tremendous amount of trainings for folks. Please check out their website, sign up for their emails. They continually tell you what's available for that. It is an amazing group, and we want to make sure that all of the people in the state who are interested in supporting employment first employment for all people can actually be part of the APSE community. It's very dynamic and it's really important. And finally, as Catherine talked about, the WISE Online Academy. I want to never can say enough about this. I'm so excited that we already have had 100 people or more talk about their experiences with taking this course. As a reminder, this course is free. If you are working in the employment space for people with intellectual and developmental disabilities, you are eligible to take this course, which is a $600 value. It will be free to you in North Carolina. We are really happy to be able to support this work. It is self-paced and it is online. And unlike the SELN course, it does have, you have a lot more time to complete the course. When you are finished, you get an ACRE certification. This is a really valuable addition to your resume and makes you extremely attractive to employers. So please look at the WISE Online Academy. If you need help accessing the information so that you can register, just reach out to any of us on this team. Again, my email is pretty much everywhere, and we will be happy to make sure that you get access to that course. Cannot say enough about it. And those folks who have participated in this already have felt like have given us feedback that it was really vital to the way they do business. So those are some training opportunities. There will be more to come. And we will be talking about those in future visits, future community meetings. So next slide. Okay, let's look at our Q&A. I answered one question in the Q&A, but the next one is there any feedback around the VR EIPD documentation requirement and being able to get the generic letter to support people who have been in service, but there's no historical feedback received when advocating? I'm going to pivot this one to Adrian Kittle. This is something that DMH, CDSUS, and EIPD and DMH have been working really, really hard on, DHB rather, over the last year. So Adrian, can you speak to this question, please?
So can you tell who
It just says anonymous participant.
Anonymous. Okay. So I can speak a little bit. I know there's some confusion on this and I think it falls to the service definition for supported employment through the tailored plan. So the focus is, or the primary emphasis is that individuals should come through EIPD as the initial primary funding source for services related to employment. And obviously that's reinforced now that we have pre-employment transition services through EIPD that can begin as early as 14. But for the supported employment service specifically, EIPD is the initial primary funding source. And then after our services help someone get a job, then we, under supported employment, we provide some intensive training or initial job coaching support to help that individual learn the job, establish those relationships in the employment setting. But then at that point, shortly after, when things are in a flow, we transition our funding ends, and then we transition back to the tailored plan to provide those ongoing supports that the individual needs to maintain employment. And so under the service through the tailored plan, there's an authorization, the service and funding have to be approved. And sometimes that's when the request for that EIPD letter comes in. So obviously it's easy. If we've provided services, the counselor can provide written documentation to say that when our funding ends, and then the tailored care manager uses that documentation to seek approval for the funding through the tailored plan. But I think the questions are coming up now and I hope I'm speaking to the question that was asked, when someone may or may not have been through EIPD in the passed, and for whatever reason, the tailored plan is requesting that letter now. It's my understanding, in speaking with Claire and our department meetings with DHHS, that letter at that point, once someone's authorized for funding through the tailored plan, there shouldn't be another need to provide that EIPD letter. But we're trying to work through that a little bit and provide clearer guidance. But if that happens, I think you can speak to the tailored care manager, and certainly reach out to me. I'm in conversation with our local offices when some of these requests come in, so that we can try and resolve the situation. If somebody's receiving services through the tailored plan and happy with their provider, we don't want to disrupt things by making someone come back to EIPD, where we might not have the same provider network, and that doesn't make a lot of sense to me. So we're trying to address those questions as they come up, but that's really, the letters should be requested for current recipients of EIPD services as we transition to long-term supports. Once someone's receiving services through the tailored plan, that letter should not be needed any longer. Did I cover everything, Claire?
I think so.
Okay.
It's great. Thank you, though. I see there's a little bit of a follow-up question, and I think you may have answered it, but in the past, there has been a gap between the EIPD case closing and the start of waiver services. Has that been resolved? So I think you may have covered that, but can you speak a little bit directly to the question?
So we are trying to do better of that, and there is this thought that the EIPD case needs to be closed before funding through the tailored plan can start, and that's not actually true. So our funding ends for supported employment services ends in what we call stabilization, and extended supports or long-term vocational supports begin following that stabilization date. But EIPD keeps the case open for at least 90 days to make sure the job is going okay, and people are still satisfied with their employment. And but that EIPD funding ends at stabilization. So that's what we're trying to avoid there being any gap. And part of the work with the CI liaisons that I had mentioned earlier, we need to have more conversations on the front end when we're initiating the supported employment service, so that our EIPD counselors are working closely with those tailored care managers to coordinate the funding, so that we have an idea of when that funding will be ready. So we're not in the position of placing someone in a job, and then there might be a gap in that services or funding. And we don't want that for our providers, because then they're kind of stuck and have no one to hand it off to if they're not going to continue to provide those extended services, which does happen from time to time. So ideally, there would not be a gap between the funding sources.
Thank you, Adrienne.
You're welcome.
So I hope that answers some of the questions. I know this stuff has been very confusing. And even though some of us who do this every day, we sometimes are like, wait, I have to think, and constantly asking each other. So it is complicated, it is confusing, but we will do everything in our power to help overcome some of these obstacles, so that those of you who provide services, those of you who need services, those of you in the LME MCO space who are trying to help people pay for services, we are working really hard with folks to try to resolve some of these issues. We will continue to be doing this as well. Our work has not stopped. And believe me when I say we pay attention to this issue quite a bit. It's pretty important. So thank you for those questions. I did see that there was a follow-up question regarding who is eligible for having employment services. And I did answer the first part of that question live in the Q&A section. The follow-up question is, and the first answer I wrote was that if you are on the innovations waiver, you can get excellent employment services through the innovations waiver, but anyone else who doesn't receive the innovations waiver, if you're receiving 1959 services, that's great too. You can access all of the employment services that Inclusion Works throughout the state and our partners throughout the state are trying to make sure that are available to everyone. So the next part of this question was, does that mean even without having Medicaid, someone could use employment services? The answer is yes. We have some state-funded services that are available to folks who do not have Medicaid. Again, we have state-funded services, and please reach out if you're having trouble, if your provider is having trouble accessing services, and if you're a provider, please reach out if you're struggling with any of those issues. But yes, people without Medicaid can definitely receive employment services. Marilyn, I did put a link in the chat to NCAPC. NCAPC is the North Carolina Association for People Supporting Employment First. Can't say enough about what APSI does. On the website, there are trainings and there are explanations of different things that they offer. So please reach out to APSI, and you can, like I said before, you can sign up for their newsletter, their email, and you will get continuous information. North Carolina is an employment first state, and so our APSI connection is very, very important. Brad, it says $600. Oh, I'm going to send this right to you, Catherine. Brad says it says $600 when going to the website for the WISE training. Catherine, can you help him out there?
Yes, I can. Sorry, I'm trying to get my camera on. Brad, when you add the training to the cart, it should, and go to the cart, it should show 0 with the North Carolina code. So if that is not what happens, I'll put my email address in the chat box. Oh, good. I think that is what happened because you're thumbs upping. So great. Yeah, it will automatically apply once you go to the cart. So thank you for asking about that.
Oh, that's great. I'm glad we were able to solve that. We had glitches initially. Catherine and I were kind of like, wait, what have we done? But I think we solved those glitches, and people now can put it in the cart, and you will see that you will pay 0 for that one.
Yeah.
Brad, I love this suggestion that you have made, maybe a future training about how IPS and customized employment compares and contrasts. Brad, reach out to me, send me an email, and maybe we can talk some more about that and what that looks like. We are definitely trying to do more with customized employment, and that is a lot of what the training we offer talks about. So Brad, you gave me a suggestion, and I might volunteer you to work with me on that. I appreciate it. And finally, will this be put in writing? I think we're just going back to the EIPD question. Will this be put in writing in a memo to support this feedback? I will reach out directly to Adrian with client-specific alerts. I absolutely encourage you to do that. Adrian can really help you understand a lot of what's happening. And she has access to the specific client information as well. And the different things of the documentation that are happening. So Adrian threw you out for that one. And how can we provide feedback on this process that's actually occurring? Significant gap between what you're describing and what we are actually seeing in the field. Sure. It is always an issue, right? We have plans and implementation strategies, but if not everybody can access and do that, it is one of our biggest concerns. Coming to this meeting can help and providing feedback. And again, I encourage you to send an email to myself, send an email to Adrian, anyone on this team, and we will absolutely listen to your concerns. This is the kind of thing that we are trying very hard to close that gap. I know that there is often a very different experience out in the world than what we talk about here. And it's really something that we're trying to work on. So again, I ask you, reach out to me, reach out to Adrian, and let's see how we can help address your specific problems. We know there are issues to be solved. It's an ongoing area for us that we never lose sight of. So thank you very much for saying it. I think that's also really important. That is it for questions that I have. Were there any additional questions that we have not answered so far? Okay. I'm going to turn it back to you, LaToya.
Thank you, Claire. The recording and presentation slides for today's event will be posted on the Inclusion Works website. The link is included in the chat. There will be a brief survey following today's webinar, and we would appreciate your time completing it. The next Inclusion Works Community Advisory Committee meeting will be Tuesday, April 21st at 11 a.m. This concludes our webinar for today. Thank you for attending.